Hello, everybody. Welcome back. This is week 2 of Coaching for Wellness and Physiological Integration. So last week we had a introductory session where we talked about what the definition of coaching is, what coaching for wellness also means, as well as introduction to two primary theories, if you will, that we will be utilizing in this class. And one is the positive psychology lens, and the other is the self-determination theory. So, with those theoretical underpinnings, today what I thought I'll talk about is upon those basic premises and assumptions, what are some things that we need to consider before we actually move into concrete skills or concrete activities that will be introduced throughout the semester? So, this picture, you may have encountered this in your courses or in your practica, but just shows you depending on what your perspective is or where you're at in understanding an object or understanding a situation, it might incur different results. So, in thinking about how to apply coaching models and understanding your client and their process of change, a caveat for you to remember is that you don't want to lose sight of the pictures that you're only seeing at the moment and certain times because of your respective disciplinary expertise. That's going to guide you what you'll first see, of course, because that's just the training that you've had thus far. And so you will, when you encounter a client, you'll first see that, oh, this person is fit, or this person is eating healthy, or this person is having a sedentary lifestyle, or this person's walking movement is imbalanced and stuff like that. And for those of you who are more on the mental health field, the first thing that you'll see is, oh, they seem articulate or they seem energetic. Their mood seems to be a little down. And if you're someone who's in a school counseling field, you'll first see their academic grades, how their social relationships are, and stuff like that. So, depending on your respective disciplines, of course, the first thing that you'll see will be very different. But that doesn't mean that the clients that you see and the patients that you see are a whole being, just like the elephant here is a whole animal. So I never would want you to lose track of the whole picture that you are not seeing because of these disciplinary expertise that you're building in your respective disciplines. So with that in mind, let's think about what change really means. And oftentimes, clients come to our sessions unless we do like an outreach to recruit patients or clients. Oftentimes, clients come to our session, right? So, that in and of itself means something that they are on their trajectory towards change. So, the assumption that we typically give to our clients and patients is that they want to get better. And of course, here again, depending on what your discipline is, the better would mean a wide array of things, right? So, someone, again, like losing weight, or someone eating healthily, or someone meeting a target of having 1,500 calories per day. And it could really mean anything depending on your clients and patients presenting concern. So, our assumption oftentimes is that our clients and patients want to get better. But sometimes this might not be a viable assumption for you to have. Sometimes someone just comes to you because they are forced to be there, or they think that they want to change and they want to get better, but they don't know what that is, nor do they want to change in an energetic way, if you will. Like they're kind of ambivalent about change. They thought about change, but they really don't know how that's going to look like, and they may have some anxiety or fear about changing. So whenever you're seeing your clients, always check your basic assumption of, do they want to get better, and what does getting better mean for them? And once it's been determined that your client wants to get better, then what you want to assess is that it's not, and it's less of a matter of whether someone will get better, but it's really a matter of helping your clients and patients find why they want to get better. Of course, everyone could say, oh, yeah, I want to lose weight because that's going to be healthier for me. I want to eat healthily because that's going to be healthy for me. But why do you want to be healthy in the first place? Because that's going to give you more confidence in interacting with other people, because that's going to have you be more energetic in living your daily life, or that's going to make it just like have you feel good about yourself. So of course, yes, the concrete outcome of what you want to achieve is losing weight or getting fit or eating healthy, whatever that might be. But really, why that is what clients or patients don't typically talk about. And they would say something as ambiguous as, oh, I've always wanted to have a healthy lifestyle. And of course, yes, that makes sense. But you as a coach will help them get deeper into what's at the core of them wanting to get a healthy lifestyle. And so, just like what I've introduced in the previous slide, you don't want to get lost track of the whole picture, what you're not seeing at the moment, and what your clients and patients are not showing you at the moment. But at the same time, you also want to tap onto some of the deeper roots of why your clients and patients want to change or are ambivalent about change at the moment. And you'll see in this class that I'm introducing a lot of different activities and different skills that you will be able to apply to your clients and patients. And obviously, some will be effective to some people, and some will be not effective to some people, meaning that these interventions and these skills are not the panaceas for helping your clients get better. So, depending on what your clients and patients' inclinations are, and also depending on the timing of the intervention, where they are in the change trajectory, you want to be able to modify what activities and skills that you want to apply. So, my goal for you in this semester is to at least give you like the basic skill sets and basic activities that you can utilize, and afterwards kind of having an individualized tailored approach to each client and patients that you'll be seeing. So in this slide, I want you to think about what are your assumptions as a coach or as whoever you are in the helping profession, what your assumptions about change are. Are you someone who typically think that change is hard? Or are you someone who typically think that everyone wants to change for the better? Are you someone who typically thinks that change is just a word, and unless there is a behavior that's associated with it, it really doesn't mean anything? And really, so think about what your assumptions of change are. And for maybe some particular presenting concerns that you encounter with your clients and patients, these assumptions might come out more strongly, even without you realizing it. And next week, we'll be talking about how mindfulness really enables you to know within yourself what your assumptions are. And catch that in the moment so that you can be more intentional in your interventions with your clients and patients. So let's think about what are some mechanisms of change. So here I outlined 4 mechanisms of change, and of course this is not a exhaustive list, nor are those 4 mechanisms mutually exclusive, but each of these mechanisms kind of emphasize different things. So let's go from the first one. So first mechanism of change is designing a relationship that fosters growth and change. So I want you to think about in your own self as a health service utilizer. So as a patient or a client, you go to a primary doctor, and some of you may have had one primary doctor all throughout your life. Others may have kind of shifted from one person to another. And when we think about primary doctors, their educational background is pretty similar. They need to have MD, and they probably are licensed or credentialed through the same board. So the skill set that they have and the knowledge that they have is pretty much similar across the board. So it's not really their expertise per se, but what draws you to one primary doctor to another is just the ways in which they engage with you, right? So are they, or at least in those sessions, do they seem genuinely interested in what you have to say? Do they remember you when you revisit the next time? Do they give you more of a individualized prescription and treatment plan as opposed to what you think is more of a general bland treatment plan that could be applied to really anybody. So it is really the matter in which that, or the manner in which your primary doctor engages with you, that makes a big difference. And depending on how they engage with you, you have more trust in their expertise, even though across the board, their expertise and skill level would be somewhat similar. So that is something that I want you to remember as a service provider and as a coach as well. So skill coaches are always genuinely interested in their clients' growth and change and are genuinely interested in promoting those changes. And how you would show that you're genuinely interested and committed to the change process of your clients and patients is by providing a safe and non-judgmental space, but at the same time challenging and invigorating space for your clients and patients. So coaches are in some ways people who kind of chip away all these layers of life clutter that's there for clients so that clients could reveal the best selves so that they could engage in the change process of a target behavior that are mutually agreed upon between you as a coach and they as a coachee. And you as a coach will oftentimes, and this not only comes in more of a novice coach, but also in expert coaches as well. So expert here meaning people who are more senior. Coaches oftentimes, because they know so much and they have gone through so many coaching sessions, they've seen some of the trends of their coachees. So they oftentimes wants to give this more of a prescribed coaching trajectory for their clients. And at the same time, while that might be informative, it also takes away a chance for your clients to learn on their own. So you're kind of not valuing their learning process by taking away the pace and making it your pace and not really honoring their pace of change. So rather than valuing your own expert knowledge, although you may have all of that, you want to go into each of your coaching sessions with new clients with really a beginner's mindset, like curious about what they have to say and thinking about different activities and skills that you could apply with them, but not necessarily throwing all that out there on your first or second sessions because again that's going to take away the pace that your clients could create themselves together with you, but rather would be your pace of change and the client coming just alongside with you. And obviously, if that happens, clients will not feel as much of an ownership in their own change process. Hence, the likelihood of them achieving the goal or the target behavior that they want to achieve is going to be rather lagged or is going to be suboptimal. So the second mechanism of change is by eliciting different motivations that might exist within individuals. And this self-motivation, delineation of self-motivation comes from the self-determination theory that we talked about last week. So according to self-determination theory, there are different self-motivations, and there are two that are externally motivated, and there's one that is internally motivated. And as you could presume from the wordings of external and internal, external motivation, or also called external regulation, comes from someone else outside of your client. So your client wants to change, but not because for themselves, but because they feel like they need to change for the other person in their lives. And oftentimes these are close people in their lives. So it's their parents or their spouses, their children, their boss. And your clients would often say, I want to change my lifestyle because that's going to be good for my husband, or I want to change my lifestyle because that's going to be good for my wife or my partner. So really, they want to change. So your clients want to change, but because they want to please other people and to avoid conflict with these other people. Another motivation, external motivation that exists, that also facilitates some of somewhat of a behavior change, but of course not as much as internal motivation, is external motivation that has been internalized. So you're not wanting to change because of someone else, but because someone else's standards has been internalized to you. So you have all these very self-critical or more of a end dead end type of self narrative, such as I should exercise or I must eat better. I should be able to work out 3 times in a given week for 30 minutes, walking on a treadmill or something like that. So here they are, it feels like they're internally motivated because it comes from the I statements, such as I should, I must, I ought to do it. But when you ask, like, why do you need to change or why do you need to meet this target behavior, that standard comes from an external standard that has been internalized to your clients. So the motivation is there, but it is not really aligned deeply to personal values or desires that your clients have. The third motivation is what we want to target. So if we see clients who are externally motivated, externally regulated, we want to ultimately, through asking open-ended questions and also gathering more information from them, and help them find what are some internal autonomous motivation that they have for themselves, because autonomous motivation comes internally as it is aligned well to your own personal values and desires. Hence, it leads to more of a sustainable motivation, hence leading to more of a sustainable change pattern of a behavior. And also, autonomous motivations have a future orientation. So, for example, you're not saying that I want to eat better because it's going to please my parent. You're not saying that I must eat better. You're saying is I want to eat better because I want to have more energy to make a difference in my daily life. So the last example that I just gave you is a reflection of autonomous motivation, which kind of puts your clients to look forward to have more of a future orientation of if I make changes, then that's going to incur these positive changes in the future. So it connects your own personal desires and values, but also kind of adds in that time frame of having a future oriented mindset, which does not exist in the external motivations that I just introduced to you previously. So if you foresee your clients and patients, see how you could elicit their self-motivation. And if it starts from external motivation, whether that be having a standard outside from someone else or having that internalized to your client, help them move that into autonomous motivation so that it could be more sustainable. So the third mechanism of change is building confidence together with your client. Of course, you can have all the autonomous motivation. So you as a client here, you can have all the autonomous motivation, but if you don't have the confidence or self-efficacy to be able to overcome an obstacle, then that's not going to really incur any changes, right? So typically, building confidence involves trying out something, and it also involves diligent efforts over time. So one thing that you want to remind your clients and patients and your coaches, of course, like all synonyms here, is that building confidence would only come if your coaches try out. So it's not something that's automatically going to be granted to you. If something, a target behavior feels easy to you and you feel confident that you can do it, then probably that target behavior is not the target behavior that you want to work on because you already feel confident in doing it. So you as a coach would help your clients set the target behavior that's going to help your clients feel and build confidence and self-efficacy by helping them kind of get out of their comfort zone just by little. So it could be 1 more minute of something, it could be one less of something, it could be any measurable changes from the previous, but it has to be some sort of increment or some sort of reduction from previously that involved a little bit more of effort. And you as a coach would really make that explicit so that your clients or coaches would be able to build confidence based upon their experience from the previous session that they had together with you. And certain times, building confidence doesn't come naturally because obviously if everyone was confident and everyone was autonomously internally self-motivated, change would be so easy and they wouldn't come to you and you would be out of jobs. So building confidence is a very hard thing, and oftentimes kind of lessening the tension, if you will, or bringing down the tension that exists in the air in your coaching session helps a lot. So utilizing humor also is one of the character strengths, as we'll talk about later, but using humor is something that also kind of tears down the tensiony vibe that exists in coaching sessions. And using humor and using positive emotions actually kind of broadens the attention span that people could put at that moment. So it helps them to feel like they could be more resilient, could be more tough in overcoming adversity or in dealing with setbacks. So sometimes utilizing humor and positive emotions would be helpful in you as a coach, helping your coachees build confidence in trying out a new behavior that seems a little bit more challenging for them. Of course, here, positive emotion is not the panacea. I know one of the myths, as I talked about last week, that positive psychology is just everything about being happy, being fluffy, being like bouncy. It's not all that at all, really. But positive emotions do help clients be more open-minded and creative because according to a theory called broaden and build theory, positive emotions uh, what's the word, broadens the attention span, as I said, and helps people accrue experiences that's going to be built upon from one experience to another, and hence building the confidence of your clients. So the last mechanism of change I want to introduce is the process of change. And you may have encountered this multiple times again in your courses because it's one of the most widely accepted process of change. But in case you may have not encountered this, I'll just introduce to you briefly what this is about. So when thinking about people changing, we talked about different disciplines in which we're at. So what are some like the first impressions that we get when we see clients? We talked about what are some assumptions that we have about change. We also talked about why we want to ask our clients why they want to change. And we also talked about different mechanisms of change, right? But lastly here, what I want to talk about is that people when they say that they want to change, or even if they come to you without articulating the fact that they want to change, they might be at different stages of change or towards a change. So this trans-theoretical model of change adds a temporal dimension. So helping you, if you will, I see this model as more of a like piecemealing, if you will. So making the change process more concrete than just having the change process be as ambiguous as this whole like vocabulary of change process. But it adds a temporal dimension to change. So when clients or coaches come to us, they might be at pre-contemplation stage, contemplation stage, preparation stage, action stage, and maintenance stage. And depending on where they're at and how you would assess where they're at would be through you asking them questions and seeing their just attitudinal resistance or reluctance towards your suggestions that you will be making as a coach. But as you assess where they're at, your interventions should look different. So people who are at pre-contemplation stage, you will not likely see them because if they're pre-contemplating, they're not probably going to come to your sessions. So people who are in this stage are either not aware that their behavior is a problem or are in denial that their behavior is a problem. So they're like, oh yeah, my smoking is not a problem. It's just my lifestyle that I've kept for 20 years. And they wouldn't know about all these reasons why they want to quit smoking. And of course, quitting smoking is not something that everybody needs to follow, but let's say this client or coachee had a health condition that gets complicated through smoking, so that person needed to quit smoking, but they might not even acknowledge that smoking is a problem for them. And some of the helpful strategies, if you do end up encountering clients at this phase, although it's unlikely that you'll see them, unless again you go out for an outreach or something like that. Some helpful strategies that you could use is to help them think about what that behavior is and how helpful that is in their grand scheme of health, and explain and give them a little bit of knowledge of explain to them what are some of the risks that their current behaviors have in relation to the ultimate goal or ultimate health that your clients would like to achieve. The second phase is the contemplation phase. So people are a little bit more aware of the potential benefits of making a change, but they're also aware of the costs that comes with the change. And obviously, change means it's change, right? So there's going to be pros to the new change, but also cons to leaving behind what was the default for you. And for some people, the cost tends to stand out more. So oftentimes, our clients will come into us in this phase. So they are being pretty ambivalent, but the fact that they came into your session means that they've at one point weighed high to the benefits that would come through making a change. So here, the strategies that you could use as a coach is having them acknowledge that they are being ambivalent, which is quite normal and typical, and point out what are some of the conflicted emotions that comes along in preserving the status quo and also in making a change to potential benefits, and kind of pointing to them the ambivalent nature and the conflicted emotions that they are facing, and also laying out what are some anticipated outcomes of making a change. The truth is, in this phase, some people might not be able to make any progresses after this phase, whereas other people, once are confronted with their ambivalence, are more inclined towards making changes. So, you as a coach, what you want to remember is that contemplation phase in and of itself is a long journey. So even if you are not able to make like a quick transition for your clients or coaches, that doesn't mean that you're a incompetent coach who are not able to talk out your clients or coaches in making a behavioral change after that. But if you were able to point out the ambivalence and have your clients and coaches buy into the potential benefits of making a change, then your clients will be moving on to the next stage, which is making small changes to prepare for a larger change. So if someone is wanting to lose weight, smaller goal that this person might be doing in this preparation stage is maybe looking for different diet options, or looking for different gyms in the neighborhood, or looking into or even changing into lower fat foods and stuff like that. In this phase, people will likely be very vocal about their change, as well as consulting quite frequently with you as a coach and what they need to do to make a larger change, a larger action happen. And really, the fulfillment of a coach, I think, comes from seeing the changes that happen from the contemplation stage to action and maintenance stage, because it has a very quick pace, if you will, in people moving from contemplation and preparation and making actions to achieving their larger goals. And once they've achieved those larger goals, getting into the maintenance phase as well. So, in looking at these trans-theoretical model of change, if you are currently in your practicum or internship or in your clinical setting, I want you to think about one or two clients that you're struggling right now and see where you think they lie in this change phases, and what are some different strategies that you can use now that you know that they are in these different change phases that you have maybe not considered thus far. All right, so that is it for this week. And starting next week, based upon the theory from last week and some of the considerations that we want to have in understanding the whole change process of our clients and patients, starting from next week, we'll be starting more concretely about specific skills. As always, if you have any questions, feel free to either ask me or Matt. We're always available via email. All right, so I'll see you in my next lecture.